the area of breast cancer, there have been several updates for people that are living with metastatic breast cancer. This is an area that, of course, is a difficult area in that we are still looking for treatments that make big differences. While we do have treatments that are active against breast cancer and they can control it for different periods of time, we are still looking for that one drug that makes a big difference, that gives people very long remissions, maybe someday finding a cure, but we're taking them at small steps at a time. Also, there are a lot of practical issues for patients with metastatic breast cancer. One of the most commonly used drugs is for patients that have bone metastases, which is the most common site of metastases and accounts for a fairly large proportion of patients. These patients are given a drug to protect them from side effects from bone metastases that include fracture, bone pain, the need for radiation, the need for surgery. Together, we call these skeletal-related events. Bone-targeting drugs, such as bisphosphonates, which are also used for osteoporosis, and also a new drug called a rank ligand inhibitor known as denosumab or Xgeva, are both used for patients with bone metastases. They're given every month. The more common of these, Zometa, is given by vein, and it can be an inconvenience for a lot of patients that have to come in every month, especially patients that are on hormonal therapy that are just taking a pill, yet because of this they now have to come into the clinic. We as clinicians know that sometimes these patients can develop complications of these drugs, such as kidney problems, or very rarely they can get damage to the jawbone, known as osteonecrosis of the jaw. And many of us have been dialing back how often we give these drugs to our patients after they've been on for a while. So there was a formal study that looked at continuing every month versus giving it every 3 months. It was a study called Optimize, and it took patients who had been on for about a year, getting monthly Zometa, and compared continuing every month to every 3 months. And what this study showed after a year of follow-up is that it was really no different. About 1% of patients had one or more skeletal-related events was seen in about 22% of patients on either arm. And there was a slight difference in the number of people that had kidney side effects. It was lower in the group that got it every 3 months, and osteonecrosis of the jaw was only seen in 2 cases, and they both happened in the monthly group. So it really looks as though we can back off and give this drug every 3 months, which will be an important advance for people that do have to take this drug.